Welcome to Education Forum. I'm Herman Badillo, Chairman of the Board of Trustees of the City University. The improvement of education affects all New Yorkers. This program will focus on the key educational issues and challenges before us all. My guest today is Dr. Rosa Gil, who is the new Dean of Health Sciences at the City University. She was just appointed by us, and she comes to us from the New York City Health and Hospitals Corporation, where for many years she was the chairwoman of the board and the mayor's special advisor on health policy. She was born in Cuba and graduated from Oriente University with a bachelor's degree, and then came to the United States in 1961 and graduated with a master's degree from Fordham University and a doctorate from Adelphi University. And she spent her whole life basically on health services. So welcome, Dr. Gil.
Thank you very much, and I'm delighted to be here.
Well, we want you here because we have a large number of colleges that have courses on health careers, and that includes community colleges as well as senior colleges. And I think we all realize today that health careers are the careers of today and of the future. And just recently we saw in the newspapers that there's an incredible nursing shortage, not just in New York City, but throughout the country. And so we want you to look at all our colleges and see what can be done to improve the curriculum and also to get more students to apply for health sciences. What have you found so far?
Well, in CUNY we have 9 programs that do provide education for persons to get the RN degree. Of course, we have other programs that after they finish the registered nurse degree, then they can go to a BSNN, a Bachelor's in Science Nursing degree, a completion program, and we have about 4 of them in the systems. So our findings are the following, that CUNY, in a way, is not different from the rest of the nation, the rest of the state, and the rest of the city. Basically, we have seen a decrease in enrollment from 1995 to...
Enrollment in health services?
Enrollment actually in the nursing programs.
Why is that? Because all the indicators are that we need more and more nurses, and this had been known for many years, right?
Yes, you're absolutely right. I think during the mid-90s, if you recall, the introduction of managed care and the forecasting that with managed care, the hospital system was going to be reduced, that there were going to be consolidations, so forth and so on. There were some people in the field who felt that then there was going to be less of a demand for nurses because the system was restructuring itself. Those forecasts have not been found to be true.
Never happened. As a matter of fact,
right.
At the Health and Hospitals Corporation, right, where you were, what is the situation with respect to just nurses?
The Health and Hospital Corporation, like any other voluntary hospital in the city of New York, we are experiencing shortages in some of the specialty areas in nursing. For example, emergency room, ICUs, specialty areas that really require a much more specialized training. That's why I'm delighted to see that in CUNY we have nurses going for the bachelor's degree in science, because those are the areas where you need to specialize in order to meet the urgent need of the current healthcare system in New York City. So you have emergency room, you have ICUs, that you do not have sufficient nurses. However, I should say that neither the Health and Hospital Corporation nor the voluntary hospitals are not finding shortages throughout all the workforce in nursing. In other words, we are not seeing yet, it may happen in the future, that we have to close for elective surgery. That's not the case like it was like in '87.
Well, there are certain areas where there is a heavy shortage.
Absolutely, and I think that if we don't pay attention to what's happening now, I think that the forecasters will be correct in saying that in the future it will be a serious crisis. And the reason for the seriousness of this crisis, which by the way is very, very different from any other crisis in the past in the area of nursing has to do with the following. The aging of the nursing workforce. In other words, nurses are becoming older. The aging of the faculty in universities such as ours in CUNY. And then, of course, you mentioned it before, the third important factor is the aging of the population at large. So, of course, with the aging of the population, you have a higher demand of nursing services. But then your pipeline, so to speak, of nurses coming into the field, we have seen a decrease in enrollment. Actually, what we have seen is a decrease in interest in the nursing profession. Why? Well, the reality is that in the 90s, women had many more opportunities to go in other careers.
Yeah, historically, the careers for women were
Absolutely.
teaching and nursing, right?
Absolutely, that's correct.
30, 40 years ago.
That's
but
correct.
now, of course, every field
That's
is
right.
open.
And of course, you know, what's contributing also to this shortage of nurses is the conditions at work. Their salary is not as high as they would like to have salaries. And the working conditions are not conducive to the nurses feeling happy with what they're doing. In other words, the number of patients that they have to take care has increased. The acuity or the severity of the illness of the patients that they're taking care of has also increased much more. So they're feeling tremendous amount of pressure and stresses in the job. So many of them who have registered nurses degree and even higher degree are preferring to step out of the workforce and work someplace else.
Now, you were telling me about the CUNY colleges. Tell me,
Yes.
which are the colleges that have nursing and health career courses now?
We have, for example, in the borough of the Bronx, we have Lehman College, we have Bronx Community College, we have Ostos Community College. In the borough of Queens, we have York College. In Manhattan, we have Hunter College. We have the borough of Manhattan Community College. And in Brooklyn, you have Medgar Evers. We have New York City Technical College, and we have Brooklyn College. And of course, in Staten Island, we have the College of Staten Island.
Why is it that it developed in that way? Why don't we have health career courses in every college, do you know?
We have health career other than nursing.
I mean nursing.
Well, perhaps, I don't know why, perhaps that has been a decision that has been made in the past, that they offer other type of careers, like physician assistants. For example, at City College, we don't have a nursing program, but you have physician assistant program, which is also a shortage area, and you have the medical school there. But I am not confident in telling you the reason why there are other colleges that are not offering nursing programs.
So approximately in all of the colleges where we now offer, for example, nursing, stick to that, about how many students do we have enroll?
Right now, well, in the academic year of 98-99, we had 600, actually we have in 98-99, the number of graduates in the nursing programs were 657.
That's all?
That's all. Now, when you compare that to 1995, we have 986 individuals graduating in 95.
Well, even that's not enough. I mean, I would like to see thousands of students enrolled, and I would like to see new programs developed for that.
Absolutely. I think that there may be here a good opportunity to develop, to increase the capacity of the existing current programs.
Let's talk about some of the new programs. For example, you were with the governor recently and the chancellor.
That's correct.
In the announcement of a program on Fordham Road, the site of the old Alexanders.
Yes.
Tell us about that.
This is a very innovative partnership between CUNY and 1199 that we're very pleased that the governor announced the day of the conference on March 29. And this is a one floor of the former Alexander store that will be converted into an educational floor. Part of the floor will be for 1199 for the Learning Center. They also have a Learning Center in Manhattan and in Brooklyn. In the Bronx, they're also including a child care facility, which will be tremendously helpful for the employees of 1199 to leave their children there and then to put themselves at the task of studying. Now, the programs that will be offered at the 1199 section of the floor, and then Lehman College and Ostos Community College and Bronx Community College will also have the rest of the floor to offer programs. One of the idea here is that you're right, that I think that we can make efforts to bring more individuals to the nursing profession. And a way of doing that is looking at the current workforce, like at 1199, and helping the employee to acquire basic skills, and then also get some credit courses to prepare them for the nursing program.
Let's look at the governor when he was making the announcement for this program.
Great.
We have in this state 103 institutions of higher learning that train our nurse practitioners and registered nurses, a lot of them through our state university system. I think it's 13 in the city university, others in the private educational system. But what we don't have is someplace in the city, in the community, where healthcare workers currently employed can upgrade their skills and become the licensed nurses and the nurse practitioners of the 21st century. So I'm pleased today to announce, as Chancellor Goldstein alluded to, that in this year's executive budget, and it's not through the legislature yet, but the legislature is not going to have a budget unless it's in there at the end of the day, we're including $3 million to create a workforce development center to train nurses on Grand Concourse and Fordham Road in the Bronx in conjunction with CUNY. It is going to be a unique facility. We're taking the old Alexander's department store at this very high-profile corner, and upstairs we're going to renovate 50,000 square feet, and we're going to have a partnership. The state is coming up with the $3 million to renovate it. The City University will run it and work with all three of the Bronx City University systems, Lehman College and Bronx Community College and Hostos Community College. And in addition to CUNY, we will have a partnership with 1199, where they will bring their workforce training expertise and funds to that workforce development center. And at that center, we will train healthcare workers so that they can, first of all, qualify for the college courses. We'll do the necessary remediation or language skills upgrade, and then we will have courses in nursing and in healthcare so that they will be able to, at that facility or at the community colleges or over the internet, take the courses to become the licensed practical nurses of the 21st century. This is a smart thing to do. It is the right thing to do. And we know that these will be mostly adults who are already in the workforce because they have shown their commitment to the ill and the needy of this city and state. So we're going to have daycare there. We're going to have child care support 18 hours a day. And we're going to have this facility not just open during normal business days, it's going to be open at night so that people who work will be able to go to school there. And it's going to be open on Saturday, and it's going to be open on Sunday. You know, just as one example of the need we have in this state, we have over 300,000 nurses and nurse practitioners, probably 320,000. Less than 2% speak Spanish. In our healthcare system, as many as 30% of the patients speak Spanish. We are going to, in this facility, be able to get Spanish-speaking healthcare workers and give them the professional and the language skills so they can become nurses, which will add an element to the healthcare system that is currently lacking in this great city and state. So I just wanted to have a chance to come here this morning, first to thank all of you, because you are the frontline, hands-on people who provide the health care and make our system what I believe is the best in the country, in the world. I want to thank everyone up here on the dais because they are our partners in this new initiative. But most importantly, I want to think forward of those people who 1, 2, 3, 4, 5 years ago are going to be coming through that center and going to be graduating and going to become nurses who have upgraded their skills. It's the right thing for New York. It's the right thing for America. It's the right thing for our healthcare system.
We're back today with Dr. Rosa Gil, who is the University Dean for Health Sciences. You just saw the governor talking about the Learning Center in the Bronx, and you had said there are other learning centers. Tell us where they are and what they do.
Yes, there are. Again, CUNY and 1199 have done a partnership, and there's one center in...
1199 is the union which specializes in what?
1199 is the union that provides workers for the industry, primarily hospital, as well as nursing homes.
And that's headed by Dennis Rivera.
And that's Mr. Rivera is the president, and through his initiative, together with Chancellor Goldstein, that conference was offered on March 29.
Okay, tell us about the others.
Going back to the issue of the learning centers, we have one in Brooklyn, which the partner in this case is the College of Staten Island, and we have one in Manhattan, which the partner is the Board of Manhattan Community College. And up to this time, we have been able to provide over 500 1199 workers have received basic skill training, and over 350 1199 workers have already taken credit courses toward the college work. In addition, 1199 right now is in the process of discussions with Bronx Community College for LPNs training for their workers. So we are constantly trying to do programs to increase the number of registered nurses in the city, and actually through CUNY. I should also mention that DC 37, which is the union that provides workers for the New York City Health and Hospital Corporation, has recently come to CUNY to also do a program for about 15 employees who work as LPNs or as nurses A, for them to become registered nurses, and there will be between 15 and 25. And at this point, we are beginning just to look at that program to see what college or colleges.
Because I think one of the most useful things we can do is help individuals, such as those in 1199 and DC 37, who have careers in the health service, but help them move up. And that is what I envisioned when I set up Astor's Community College in the Bronx in 1968, supposed to specialize in health careers in order to give individuals an opportunity to move up into the health field. How is Astor's coming along?
Astor's, the President Fernandez and myself, we have met, and I have met with the different directors of her program. She have a nursing program, she have a rad tech program, and a dental hygienist program. And we are working together to develop a strong partnership with hospitals in the area, particularly in the Bronx and the upper part of Manhattan, to be able also to do work with the workforce of those hospitals and bring in more workers who are interested, for example, into going to dental hygiene or nursing programs. And we hope to have this program in place sometime before June. Also, I should like to add that Hunter College is almost finalizing an agreement between Hunter College, the nursing program, and 1199 for, again, registered nurses program.
Now, what inspired you to be involved in the health careers? You were born in Cuba, and you came here in 1961. Did you come with your family?
Yes, I did. Part of my family, a sister.
And then in the Oriente University in Cuba, what did you specialize in there?
My major in my undergraduate was sociology, and I came to this country. And
so then, how did you happen to choose health sciences as you feel?
Basically, my master's program was in social work, and I chose to specialize in health and psychiatric social work. So very early in my career, I had an interest in the healthcare field. Even in my undergraduate program, my major there was medical sociology, or the interest in medical sciences and social sciences. So I always have been very much concerned for the health of communities. And the best way for me to channelize those concerns is to become a professional in the field and to contribute to the community that I live in the way that I'm doing now.
Before you became the chairperson of the Health and Hospitals Corporation, what were you doing?
I was the senior vice president overseeing Metropolitan Hospital and Lincoln Hospital. And at the same time, I was the executive director at Lincoln Hospital. And prior to that, I had been the executive director at Woodhull Hospital in Brooklyn. And prior, sometime in my career in the 80s, I was at Columbia University at the medical school and at the School of Social Work. And I taught courses in health policy and health administration.
Did you speak English when you came here from Cuba?
Not that well. I had to work hard at it. As a matter of fact, I went to Hunter College.
Yeah.
And I paid for a course to try to improve my English. And through the years, I have tried to improve the language, which I think is crucial for any immigrant that come into the city of New York to work hard at this aspect of language proficiency and also to pursue their careers. And I should say that there are many immigrants in the city of New York who come with a background in health careers, and that is also another source of looking for potential students to come into nursing, into physician assistance programs.
Now, the way that CUNY is set up now, isn't it true that we have the opportunity for young people to start off, let's say, in an area like nursing or in any other field in the health sciences, and work the way up so that they could even get a medical degree, isn't that so?
Absolutely. In CUNY, we have pre-med programs that are very good. And for young people who come, who have an interest in this area of health, there are constantly new technologies. For example, we are seeing biomedical technology exploding as a field of interest and very well rewarded in the industry. So there's an opportunity for students to come into CUNY and to work their way through to get degrees in these very important careers and contribute to the city of New York.
And we have people coming from all kinds of backgrounds. For example, I noticed that at the Health and Hospitals Corporation, you have a very large number of doctors who are from India, right, and Pakistan. How did that come about?
The federal government have had legislation enacted that provided the opportunity for immigrant physicians to come. And hospitals pursue and go to those countries and bring physicians from India. And as a matter of fact, there have been discussions of trying to do the same thing for nurses in a current legislation that is being proposed in Washington.
Well, I know that I spoke to one of the directors of a New York City hospital recently who said that he had gone to the Dominican Republic and Puerto Rico looking for nurses.
That's right.
Because the shortage is so great.
That's right.
So therefore, that's why I wanted to have you more involved and get a larger number of students, and I wanted to let people who may be watching the program, young people, to know that this is a field of today and of the future, and because we have so many people who need to have a great career, that this would be the area they should be involved in.
Absolutely, and it's a very dynamic field, and it's changing, and is a good way of helping people, New Yorkers, through being a nurse or a physician assistant. Particularly, we need more nurses, so I wanted to encourage those students to consider nursing as a possibility in their lives.
But you also have many other careers, for example, gerontology, right? And others in technicians of different kinds.
Yes, we do. We have occupational therapy, we have physical therapy, we have respiratory therapy, physician assistance programs, biomedical research. We have also programs in biology, which are crucial, as you know, as a basic science in terms of developing science careers, researchers, for example. So we have a whole scope of programs in CUNY that perhaps somebody may not be interested in nursing, but you may be interested in coming to the radiology program, to the dentistry programs that we have. So it's a very large number of professions that are available to students and residents of the City of New York at CUNY.
Thank you for being with us today.
My pleasure.
You can reach us by email at our website, www.cuny.tv, or write to us at CUNY TV, 365 Fifth Avenue, New York, New York, 10016.